Hello everyone, I am Bharavi and Keni from final year B Farm of Shivaji Rao S. Dondre College of Pharmacy, Asangaon. Today, the topic for my video is the future of IVF, the new normal in human reproduction, which is guided by Ms. Swati Vakchore ma'am, Assistant Professor. The future of IVF, the new normal in human reproduction. Introduction. In vitro fertilization, also called IVF, is a complex series of procedures that can lead to pregnancy. It's treatment for infertility, a condition in which you can get pregnant after at least a year of trying for most couples. IVF also can be used to prevent passing of genetic problems to child. During in vitro fertilization, mature eggs are collected from ovaries and fertilized by sperms in a lab. Then, a procedure is done to place one or more than fertilized eggs called embryos in uterus, which is where babies develop. One full cycle of IVF takes 2 to 3 weeks. Sometimes these steps are split into different parts and the process can take longer. In vitro fertilization is most effective type of fertility treatment that involves the handling of eggs or embryos and sperms. Together, this group of treatment is called assisted reproductive technology ART. IVF can be done using couple's own egg and sperm, or it may involve eggs, sperms, or embryos from a known or unknown donor. In some cases, a gestational carrier, someone who has embryo implanted in uterus, might be used. What can I expect from IVF? The first step in IVF involves injecting hormones so you produce multiple eggs each month instead of only one. You will then be tested to determine whether you are ready for the egg retrieval. Prior to the retrieval procedure, you will be given injections of medication that ripens the developing egg and starts the process of ovulation. Timing is important. The eggs must be retrieved just before they emerge to the follicle in the ovaries. If the eggs are taken out too early or too late, they won't be developed normally. Your doctor may do blood test or an ultrasound to be sure that eggs are at the right stage to develop before retrieving them. The IVF facility will provide you with special instructions to follow the night before and the day of the procedure. Most women are given pain medication and the choice of being mildly sedated or going under full anesthesia. Medical advancements. Controlled ovarian hyperstimulation (COH) is performed to increase the number of oocytes available for IVF. COH involves multiple injections of gonadotropins and series visits to the fertility clinic for the conduct of transvaginal ultrasound evaluations and the measurements of circulating hormone level. It follows the COH is a complex, time sensitive, and intensive. Various strategies intent on reduction the number of injection by utilizing long-acting gonadotropins or oral medication are already available and are gaining increased acceptance in the field for the treatment of selection of patient population. Technological advancement. Perhaps the most promising technological development that might democratize IVF access in near term is the automation and miniaturization of the IVF laboratories. Building, staffing, and manually operating an IVF laboratory account for much of high cost, mid disruption in access, and variability of outcomes. The technological advancement include where the basic steps in IVF laboratory are identification and separation of sperm and oocytes, where this involves in vitro handling of oocytes, sperm, and embryos for their use in reproduction and comprise in vitro fertilization, that is IVF, embryo transfer, intracytoplasmic sperm injection ICSI, embryo biopsy, pre-implantation genetic testing, and gamete and embryo cryopreservation. After the copula, from the million of spermatozoa ejaculated, only a small number of amount of hundreds make it to the region of oviduct ampulla, where they encounter the egg and fertilization occur. Presumably, This subpopulation has been selected through the oviduct in a way that only those with the highest fertilization capability and the best features for supporting embryo develop get the opportunity to fertilize the egg. Thus, it may be proposed that one of the reasons for relatively low efficiency of ARTs is that we currently lack an effective methodology to separate this specific sperm subpopulation for its use in ARTs. This is especially relevant if we consider that both IVF and ICSI bypass the sperm selection operating in vivo, increasing the risk of fertilization, the oocyte with defective spermatozoa that could lead to developmental failure and even after the offspring is in the long run. The risk could be higher in clinical practice since the incidence of sperm abnormalities includes DNA fragmentation is higher in infertile men. Second, fertilization. Two common methods can be used to try to fertilize eggs with sperm. Conventional insemination, healthy sperms can mature egg are mixed and kept in controlled environment called as incubator. Intracytoplasmic sperm injection, that is ICSI. A single healthy sperm is injected right into each mature egg. Often, ICSI is used when semen quality of number is an issue, or it might be used in fertilization attempts during the prior IVF cycle didn't work. In certain situations, other procedures may be recommended before embryos are placed in the uterus. These include assisted hatching about 5 to 6 days after fertilization. An embryo hatches from the thin layer that surrounds it, called membrane. This lets the embryo attach to the lining of the uterus. If you're older and you want to get pregnant, or if you have had past IVF attempts that didn't work, a technique called assisted hatching might be recommended. With this procedure, a hole is made in the embryo's membrane just before the embryo is placed in the uterus. This helps the uterus hatch and attach to the lining of the uterus. Assisted hatching is also useful for egg or embryos that were frozen as the process can harden them. Embryo culture. Medium specifically designed for human IVF was human tubule fluid HTF. Human tubule fluid supplemented with either whole serum or with serum albumin gained great popularity for use of 2 days or 3 days human embryo cultures has been remained in use ever since. A culture medium in a foreign environment for human embryo. Hence, the design of media is complicated because the components must be selected and their concentration determined in order to minimize stress for the cultured embryo. It also becomes clear that early embryos shows an evolving needs for energy substrates, moving from a pyruvate lactate preference while the embryos are under maternal genetic control to glucose-based metabolism after active of an embryonic genome. Two investigators response to this finding by modifying the HTF media. Quinine removed glucose and inorganic phosphate QB11 for obtaining the first glucose-free medium. Pool also generated HTF variant called pre-implanted stage 1 or P1 medium, a glucose and phosphate-free medium, but additionally contained the amino acid taurine. The improved understanding of both the physiological changes in the oviduct and uterus and the different metabolic needs for the cleavage states and biostosis stage embryo led the development of stage specific or sequential complex media G1 and G2. Barons used this combination to produce pregnancy and live birth, the transfer of single viable human blastolas and the media were first slightly modified and marketed the G3 and G5 series of media. Embryos for transfer. The procedure to place one or more embryo in uterus is done at your doctor's office or at clinic. It often takes place of 2 to 6 days after eggs are collected. You might be given a mild sedative to help you relax. The procedure is often painless, but you might have mild cramping. A long, thin, flexible tube called catheter is placed into a vagina through the cervix and into the uterus. A syringe that contains one or more embryos is called amount of fluid is attached to the end of the catheter. Using the syringe, the embryo or embryos are placed into the uterus. If the procedure works, an embryo will attach to the lining of your uterus about 6 to 10 days after egg retrieval. After the procedure, after the embryos transfer, you get back to your usual daily routine. Your ovaries may still be enlarged, so vigorous activities or sex might cause discomfort. After your care team, how long you should stay away from this? Scientific advancements. Our understandings of the mechanism that control folliculogenesis has continually improved as a result of research on fertility preservation. These interactions between oocytes and the somatic cells surrounding them, as well as the vital hormones and growth factor, have been relieved by follicular in vitro culture technique. Recent developments in multi-step culture technique have made it possible to activate, develop, and in vitro mature IVM ovarian cortex tissue primordia to produce metaphase 2 oocytes. The advantages of IVM include reduced risk of OHSS and polycystic ovaries, or lower medication cost, reduce stress, and lower monitoring burden. In contrast, it has been observed that chances of live birth with IVM are slightly lower than IVF. Ovarian tissue psychopreservation and IVF have produced the chances of preserving fertility in prepubescent girls and adolescent women who are more likely to experience primary ovarian insufficiency POI or from gonadotoxic chemotherapy for cancer or other serious illness. As long as some dormant follicle are still present in the ovarian cortex. Fascinating developments in this technology may make it possible to isolate oocytes from females who have undergone POI or who have gone through natural menopause. An artificial ovary could be developed in a mouse model using scaffolds made through 3D printing for tissue engineering. Microfluid culture techniques can be used to mimic the menstrual cycle by promoting follicle development. Thus, conclusion, in vitro fertility IVF helps women to get conceived. It is likely that in the near future, as many as 10% of the children will be conceived through IVF in many parts of the world. The scientific, medical, and technological advancement have improved in many ways. So, these are the references for which we have used to collect the following data. You can refer those. Thank you.